Great, Chris. Thank you very much. And again, thank you to our friends from the media. Once again, we are here at the Cross Insurance Center in Bangor, where we have a lively vaccination clinic going. And behind Ben, my cameraman, is a great group of people who have already received their vaccine for the day. And it looks like moods are still good and people are happy, and that's great to see. I'll start off with numbers like we usually do. As of this morning, Northern Light Health is taking care of 11 patients in our inpatient setting who are positive for COVID-19. 4 of them are at Eastern Maine Medical Center, 1 at Inland Hospital, 2 at Mayo Hospital, and 4 at Mercy Hospital. In addition to that, our home care and hospice team is caring for 4 individuals in their homes who are positive for COVID-19. A vaccine update, as of yesterday, we have administered a total of 163,924 doses of vaccine. That represents 99,707 first doses and 63,997 second doses. That means that today we have hit a milestone of over 100,000 people receiving at least their first dose of either Pfizer or Moderna through Northern Light Health. And I'd like to just take a moment to thank all of the people who have made that remarkable milestone achieved. The staff that have worked at our clinics, the numerous volunteers, our community partners, and of course the team that helped put this all together. So I want to give a shout out to them and a thank you, but a bigger thank you to the people of Maine who are standing up and doing the right thing and getting their vaccine. As you know, we are aware of the recent announcement from the CDC and the FDA and have acted accordingly by pausing the use of Johnson & Johnson vaccine pending further information. We want to reassure the community that serious adverse reactions like clots are extremely rare and that this step is being taken out of abundance of caution. In fact, we are not aware of any similar events with any patient to whom we have administered the Johnson & Johnson vaccine. While the bulk of our vaccine supply has been from Moderna and Pfizer, we have administered some Johnson & Johnson vaccine, and we did need to cancel a couple of pop-up clinics due to the recent announcement. The individuals who were scheduled to receive those doses have been contacted, and we will reschedule them. We've received 4,100 doses of the Johnson & Johnson vaccine, and as of Monday morning, there were 735 doses in stock. We administered this vaccine at our mobile clinics and smaller community clinics. We continue to use the Moderna and Pfizer vaccine at our large-scale sites, including every site that the community can register for on the website. We await additional information from the CDC and the FDA, and we will be prepared to move forward with their recommendations. Finally, as I talked about last week, we know for certain that the benefits of vaccines available far outweigh any risk, and I encourage everyone to sign up for whatever vaccine is available to them. COVID-19 has taken more than 560,000 lives in the United States, and vaccination is how we will prevent further deaths. If you are hesitant about taking the vaccine, please talk to your healthcare provider. Your provider can talk to you about the pros and cons and benefits and risks and help you come to an informed decision. With that, I'll open it up for questions.
Thank you very much, Dr. Jarvis. We'll begin with Brian Sullivan from WABI.
Thank you very much, Dr. Jarvis. Could you tell us a little bit more about where the clinics that had to be canceled, the pop-up clinics were canceled, and just some of the work that's being done to get those people back in line or into appointments?
Yeah, so those were the clinics that we run through our home care and hospice agency, which often are in our more rural and underserved communities. And that's the disappointment right now with having this pause, is that we are failing to reach out to the communities that probably need us the most. We hope that, again, this is going to be short-lived and that we'll be able to resume either using Johnson & Johnson or switching to one of our other vaccine products to, again, reach out to those. Specifics we can provide to you after the press conference is over.
Thank you. And just to overall, what you're seeing in the state, do you think that you could attribute some of the rising daily case numbers to maybe an Easter surge?
Yeah, it's hard to say exactly what's causing the rise in cases. We know that variants certainly play a role in that. We know that the predominant strain now in the United States is that strain, that B.1.1.7 that was first identified in the United Kingdom, which is certainly a more virulent, meaning, or more infectious agent, meaning that it's transmissible much more readily from person to person. And so with that said, we know that has caused some of it. We also know there's been a lot of travel of late. We recently had the winter break and then spring break for both colleges and elementary schools. And so we know there was travel that occurred during that. The concern we have, of course, is that it is now the younger population, people under the age of 40, who are testing positive, much more than they did when we spoke about this over the summer or fall when we saw the similar numbers in our case counts. And that's a call to people to be aware of that, and to younger people to understand vaccination is as important for them as it is for people over the age of 50. Right now we're seeing an increase in the number of hospitalizations for people who are under the age of 40, and in fact have several 20-year-olds across the state who right now are needing critical care. This is a serious illness, it's a serious disease, and again, our single best way to get over this pandemic is with vaccination. So thanks for the opportunity to say that, Brian.
Thank you, Brian. Next up is Mal Meyer from WGME. Mal, as soon as you see yourself unmuted, go right ahead.
Thank you. My questions are involving the Johnson & Johnson vaccine. The question is, what should people do if they're concerned about this blood clotting issue or any other side effect they might be experiencing? What should they do next?
So the first thing, again, is that these are incredibly rare events. They are only looking at 6 individuals who were affected by this particular kind of clot. Over 6 million people have already been administered Johnson & Johnson in the United States. So a very, very rare occurrence and a very rare condition. However, if individuals who have received the Johnson & Johnson vaccine, particularly within 2 weeks of having that shot, experience a severe headache, abdominal pain, pain or tenderness in their leg or swelling in their legs, they should reach out to their provider immediately to seek medical attention. Again, very uncommon that that's going to happen, and very different than the normal side effects of any of the vaccines being used against COVID-19, which typically are a sore arm, maybe some fatigue the second day, and for some people, more flu-like illness like having a fever, feeling a little bit nauseated, and maybe feeling a little bit more run down. Again, those symptoms typically resolve within 24 hours of getting the vaccine, and so we're talking about something far more serious and more severe than that, thankfully very rare.
With this being so much out there in the public consciousness now, is there any concern that people might be overreacting to any possible side effects they're experiencing and how that might impact healthcare providers?
Yeah, so I don't think that anybody's overreacting, but I think people are more sensitive to it, because especially if you started to have a severe headache following administration of the Johnson & Johnson vaccine. Again, we've not seen the Pfizer or the Moderna vaccine have a similar event that's being investigated by the CDC or FDA. So with those two, we really, that it's not even a cause for concern or alarm at this time. But I do think, people do tend to pay attention to what they see on social media as well as the lay media. And so I do think that we're going to see an increase in people reaching out to their providers and saying, hey, listen, I got the shot and this is what's going on. We have informed our providers here at Northern Light Health of what to look for as far as seriousness goes and how to answer those questions should they arise from the general population or their own patients.
Thank you, Mal, for those questions. Next up is Patty White from MDBN.
Thank you very much, Dr. Jarvis. So you said that you've seen an increase in hospitalizations among younger patients. Can you tell us a little bit more about what kinds of patients are coming to your emergency departments with COVID? What ages are they, and what are notable characteristics, I guess, are these people with underlying conditions? Just tell us a little bit more about what you're seeing.
So some of the younger people, meaning people under the age of 40 who have had more serious complications from COVID-19, many of them have had some underlying conditions already. Most of them has been obesity, and so we know that obesity is one of the greater risk factors for severe disease from COVID. And again, our population, unfortunately, obesity is one of our health epidemics that we are experiencing at the same time that we deal with the pandemic. So while hospitalizations themselves are not on the rise from COVID-19, those that are being admitted tend to be much younger now. And again, like I said, we have several people in the state who are in their 20s who are seriously ill from this disease. Again, it's just that reminder that we need to keep doing the things that we're doing, limiting our exposure to people in large gatherings, making sure we're wearing our face mask while we're out in public, remaining that physically distanced, and of course, get vaccinated as soon as you're able to get your vaccine.
And when did you notice this shift in kind of the demographics of people, younger people?
We've been monitoring that, Patty, for several weeks now. But yesterday, I was fortunate to be on a call with leaders around the state as well as representatives of the state CDC, and we had a frank discussion about what we've been seeing. Again, hospitalizations themselves have not been dramatically increasing, but certainly our case counts across the state have been. And again, we're seeing that again in that younger population. There is some small good news in that. If you remember, we were talking a lot about people over the age of 60 and particularly over the age of 70 who are coming down with COVID-19 and having severe illness, and we've seen a rapid decline in that, and we attribute that to vaccination, as many individuals who are residents of long-term care facilities and nursing homes have been vaccinated. And so we've seen those case counts go down. It's an indication to us that vaccination really does work, and it can help any particular population who does get vaccinated in a large number.
Okay, thank you very much for those questions, Patty. I'm going to move on. It's supposed to be Channel 7 next. By process of elimination, I'm going to move to T. Danang. Can you hear me and unmute? Okay. If you are, T. Danang, if you are indeed with Channel 7, please send us a message in the chat window and we can try and get your questions answered. But for now, I'll move on to News Center Maine. News Center Maine, you can unmute and ask your questions. Is there some technical gremlins going on? Okay, well. We'll move on. WMTW. Let me just find you on this drop-down list. You can unmute and ask your questions now.
Hey there. I believe I'm all set. My question was already answered. Thank you, though.
Well, great. Thank you for that.
Okay. Well, we're going to move on to Eric Russell from Portland Press Herald. Eric, one that you can unmute and ask your questions now.
Good afternoon, Dr. Jarvis. I got a couple of questions. One was a bit of a follow-up on what Patty said about hospitalizations. I wonder, in addition to hospitalizations of people, younger people, and even those in critical care, are you seeing any younger people who are showing up at the ER, whether it's at Eastern Maine or other hospitals in the network, who aren't sick enough to be admitted, but they're treated and released? Do you have any information about that?
Yeah, I don't have specific numbers, but anecdotally, that's what we have shared across the state, is that we are seeing that rise of individuals who are having mild to moderate symptoms, don't require hospitalization, but certainly are positive for COVID-19. And we know this just by looking at our case count numbers each day, that we are seeing the same kind of increase in numbers that we saw in the fall. And again, it's just a cause for concern for us, particularly as we know that more of the variants are becoming dominant strains now, and some of them are more infectious, and some of them, unfortunately, cause more severe disease. And we want to protect everybody when we're out there.
Thank you. The next question I had has to do with vaccinations. Do you have a sense within the Northern Light Network of where demand is highest for vaccines and maybe where it's not quite as high?
It's hard to say about demand. I would say need is a better question for us. And so clearly in the Portland market, we continue to have a need to increase vaccination rates down there. And that's simply because of population density. And we know that the state is working to make sure that allocations meet that demand. I will say that across all of our sites at Northern Light Health, demand has been pretty high. We still have appointments available scattered across the system. So those that are looking for vaccine for the end of this week and the beginning of next week should look out onto our website and see what appointments are available closest to them, or if they're willing to travel to go to whatever appointment is available. But the number of slots are greatly decreased, and I'll tell you, one of the nice things that we've been seeing is that younger people are standing up and are getting their vaccinations done. I saw it all day today of young people coming. Oftentimes they'll come either as a couple, as what they call vaccine date, or that we'll see groups of individuals come together who are the people that they hang out with, whether that be at school or work or whatever, and coming and basically supporting one another to get vaccinated. So it's very warming to see that happening right now, but we just need to continue on. Again, we're only about a third of the way through the state. We need to get to that magic number of 75–80% of everyone in the state being vaccinated so that we can start to feel that sense of normalcy.
Thank you.
Okay, Thank you. We do have actually some extra time. I know that Mel Meyer from WGME has another question. Eric, since I've got you up, did you have any follow-ups before I move on? Oh, I think Eric must have already muted himself. Okay. Anybody who has any follow-up questions indicate so in the text window. And I think we've got a few more minutes. And now, once you're unmuted, you can ask your question.
Okay, yes, Dr. Jarvis, I know that you're just with Northern Light and you get follow up with the main CDC and, keep in tune with this stuff. Is there any understanding why, looking at the data submitted to the CDC, there have been about 57,000 reports of adverse reactions. And I know that those are just initial claim that there might be an issue or there might be a connection for further review. Is there any understanding why these 6 incidents are being so closely reviewed and causing all this pause versus the hundreds and even thousands of other reports that it receives?
It really has to do with the seriousness and the rarity of this event. So we expect there to be people that will have both side effects and some adverse reactions to vaccines. That's just commonplace for vaccines. And so I shouldn't say commonplace, that's just usual for vaccines. Again, severe reactions to any vaccine are extremely rare. But these are concerning, and of course there was one individual who died and one individual who required severe critical care, and so that's why the CDC and the FDA, through an overabundance of caution, basically put this pause in place. Again, we're not aware of any incidents happening here in Maine. I will say that as a matter of course for all vaccines, that when adverse events are reported, they are investigated. To what degree really has to do with the severity and the commonality of them. They're certainly not going to evaluate everybody that complains of a sore arm. That's a normal side effect. It's really when they're looking at some major adverse event. And again, I think in this case, it was done out of a sense of caution. And hopefully after the ACIP, the Advisory Committee on Immunization Practices meets today, we'll know a little bit more and we'll know some more specifics than what's been reported already.
Thank you very much for that question, Mel. And I do have one more follow-up. It looks like Dr. Jarvis from Brian Sullivan from API.
Thank you, Dr. Jarvis. I think that Johnson & Johnson maybe was doing some work in investigating the vaccine for younger people, children. Could you just give us a little insight as to what that might mean moving forward in terms of when we might get kids able to be vaccinated, and maybe the other work that's being done with Moderna and Pfizer as well?
Yeah, so we are aware that Pfizer is very close, if they have not already, submitting for an addendum to their emergency use authorization to include individuals over the age of 12. So right now Pfizer is approved for 16 and above. It will be a game changer for us because obviously the more people who are eligible to get vaccinated, the better it is for all communities. I am aware that Johnson & Johnson, much like most of the vaccine companies, was looking to see if the safety profile for younger people for Johnson & Johnson, the sadness that really upset those of us in population health and healthcare right now about Johnson & Johnson was because that was a more stable vaccine, could be used in more situations than what we can use Pfizer and Moderna, and that would include offices. And so if they were to get a permission to use it in younger people, then we could see pediatric and family medicine practices, be able to administer on site. We'll have to continue to do the work that we've been doing behind the scenes to prepare our practices to be able to administer Pfizer and Moderna, which is a little bit more challenging logistically. But as we hear more about those, and particularly Pfizer, if they lower the age for Pfizer, we will be prepared to meet that for our communities as well.
Okay, thank you very much, Dr. Jarvis. Thank you again to members of the media who are here for this virtual press conference. Before you leave, again, if you want a copy of the video, the high-resolution video, just indicate so in the chat box before you leave this press conference, and we'll make sure to get you that Dropbox links. With that, I'll just leave it to you, Dr. Jarvis, to have the last word.
Well, great. Thank you once again. I just want to say thank you to everybody. I want to celebrate the milestone of 100,000 individuals in the state of Maine getting their first dose through one of our Northern Light entities. And I also want to say, with everything that's going on in the media, remember that adverse reactions to all these vaccines are extremely rare, and that the benefit of the vaccine more than outweighs the risk that any vaccine carries. Please stand up. Please get vaccinated. Please make Maine safe so we can all get back to a normal sense of life. Thank you again.